My name is Dylan White, and I'm here to present the case of Angelina Johnson. The patient is complaining of fever, cough, fatigue over the last 5 days. She is a 37-year-old African American female with primary symptoms of fever, fatigue, cough, with sputum production, shortness of breath, and myalgia for the last 5 days. The symptoms have been gradually worsening, and she has been unable to fulfill her duties as coach of her daughter's soccer team, so she has come in to see her primary care provider. She has asthma and seasonal allergies that have been well controlled. Her personal medical history includes asthma, allergic rhinitis, and hypertension. Her family history is non-pertinent. Her social history includes Blue Cross and Blue Shield group health insurance. She's a non-smoker. She has 2 young children, and she is not currently pregnant or breastfeeding. She has a penicillin allergy with a reaction of diarrhea and a latex allergy with a reaction of a rash. The current medication she's taking is calcium carbonate 1000 milligram by mouth twice a day, atenolol 50 milligram tablets by mouth daily, a prenatal multivitamin by mouth daily, ProAir 180 microgram inhaler as needed every 6 hours, Brio Ellipta 125 microgram dry powder inhaler daily, and fluticasone 50 microgram spray daily. Her childhood immunizations are up to date. She received an influenza shot in October of this flu season, and she received the Pneumovax 12 years ago. For her review of symptoms and physical findings, she had chills, fatigue, fever, malaise, congestion, chest pain, and myalgia. She had cough and sputum production, shortness of air with no wheezing. She was alert and oriented ×3 with normal breath sounds, no wheezes, but does have a tenderness to palpitation. Her blood pressure was 128/72, a heart rate of 83, a Tmax of 101 degrees Fahrenheit, respiration of 16. She is 70 inches tall, 150 pounds, with a BMI of 21.5 and a serum creatinine of 0.9. Her creatinine clearance is 92 milliliters per minute, and she did have a chest x-ray that showed consolidation with a small pleural effusion in her right lower lobe. The left lung is clear. The problem stated is community-acquired pneumonia. The evidence is the chest x-ray, which is the gold standard for diagnosing pneumonia, her 5-day worsening of symptoms, her contact with children, asthma, and the elevated white blood count. The rationale for the plan is she has a CURB 65 score of 0 with a comorbidity of asthma would justify a respiratory fluoroquinolone or a macrolide plus a beta-lactam. The goals for the patient are to treat outpatient, prevent the worsening of her symptoms, and clear her right lower lobe of infection. The drug regimen would be Augmentin for 5 days and also azithromycin for 5 days. For safety, monitor GI upset and rash in the Augmentin, nausea, vomiting, diarrhea, and QT prolongation in the azithromycin, and then for efficacy, monitor her white blood count for both. Thank you.